Hi everybody, it's the Dental Geek. Hope everybody's having a great Saturday today. A few weeks ago, I had Dental Geek's Dental Practice Management Conference here in Hickory, North Carolina, and had a great time and met lots of great people. And I talked about actually 15 key dental practice systems at that meeting. And today I just wanted to brief you on my top 10. And I'm a big fan of systems. I think it helps your practice run more smoothly and efficiently and can be more productive, and it helps all your team members know exactly what's expected of them, and there's less communication problems and less team member issues if you stick by your systems. And you have to stick by them, and you have to hold people accountable, otherwise it doesn't work. And so the first one I want to talk about is your morning huddles. I hope that everybody's having a morning huddle about 10 or 15 minutes prior to the first patient scheduled, and you should be using that time to discuss your schedule, places that you may get bogged down and you may need to shift other team members around. It should not be a gossip, drama, gripe fest, but do just concentrate on the schedule, the patients that are coming in, who owes money, who needs treatment, those types of things. And it's again, stay focused and stay on task so that it'll be more efficient for you. The second is the daily priorities for your team members. You want to make sure that each day that your team members know exactly what's expected of them. Even have a task list if you need to. I'm the type of person that likes to write everything down and check it off. So if you're that type of person, great. If not, you can use Slack or some other type of program to just make sure that everyone knows what is expected of them. And of course, your hygienists and your dental assistants generally know what they're expected to do each day. This may be more focused for your admin team, but if your assistants or hygienists don't have patients in the chair, there's other tasks that they could be doing as far as recalls and different things like that. We'll talk more about that in a moment. The third is your daily chart audits. I'm a firm believer in that. I believe that every day or the day before, each assistant and hygienist needs to review their schedules for the next day and just go through their chair or their column, whatever you want to call it, and make sure that they know who's coming in, what's going to be done. If that person needs additional treatment, it's a great time when you have them in the chair to educate them on that and encourage the additional treatment that needs to be done. Also, to make sure that you have everything that you need for that appointment. Make sure you have the proper supplies, make sure the lab work is in, whatever it is, and that way you know prior to the patient sitting in the chair and then thinking, oh gosh, the crown's not even here. And because that does not make you look good, it's not a good thing for your patient to have to come back. And so it just helps you be more confident and know exactly what's going to happen and make sure you're prepared for that appointment. The next system is recall strategies, and it's very imperative for your practice to have a great recall strategy to be successful and productive. I'm a big fan of Weave. If you followed me, you know that. And they have a great system that they will actually just automatically, you just program it in. And I'm sure the girls and guys down at Weave can help you with this if you don't know how. But you just program it in for however many days you want. A text, automated text to go out to remind that patient, hey, you're past due on your hygiene recall. Give us a call or text us, whatever you want it to say. Going back to the task list, if you have staff members that have nothing to do, there's always reports that they can work on. If it's recall, hygiene recall, or pending treatment reports, and I'm sure your practice management software has great reports for that. Weave also has in their analytics program where you can see who's past due or who needs treatment, and you can just text them directly from your desktop app from Weave. And so either if you're printing it from paper and handing it out to staff members, or if you're using Weave, either way, make sure that the recall reports are being taken care of. You also want to make sure your schedule, I'm a big fan of block scheduling, and you want to make sure that is, this blocks add up to be the proper production goals that you have for that day. And if you need help with that, of course, just let me know. But just make sure that you using the blocks, try to make the blocks as simple as possible. You don't want too many choices and options that confuse your team members. But if you just make it simple, if these things are put in these proper blocks, then you're going to meet your goals for that day. Another way to improve your production in light of the block scheduling is try to emphasize same-day dentistry. And I'm not necessarily talking about same-day crowns or things like that, but if you have the patient in the chair, say for an emergency of a broken tooth, and you can find time in your schedule to go ahead and do the crown that day or whatever the treatment is, obviously that helps you for your daily production goals, but it also saves the patient from having to come back 2 weeks later and have to go through all this, take another day off work or miss time at work or whatever it may be. If financially they're not prepared, if you have an iPad in the office, or you could even let them use one of your computers, I'm sure you could go on with the iPad, go to your Care Credit or Lending Point, whatever it is that you use, and let them go ahead and fill out an application and take advantage of those third-party finance companies if they need help with that, so that they can go ahead and get that work done that same day. And again, emphasize that way you don't have to miss more work or whatever it may be. The next thing is kind of goes back to the recalls, but it's outstanding treatment or overdue treatment. Make sure that those reports are being pulled and that you know who needs treatment, and if you need help filling the schedule, that's a great way to go or to start. And again, We've also, in their analytics program, makes it so simple. They tell you exactly who needs treatment, what the treatment is, the dollar amount, and again, you can just text them right from there to say, hey, we went through a report, saw that you recommended treatment, whatever it is that you want to say. But again, if you don't have Weave, I'm sure other programs probably have something similar, or again, just run a report from your practice management software and start passing out those reports to team members that need something to do. And the next thing is make sure that you have productive team members. I firmly believe you should have one every month. Make sure that it's scheduled. Maybe on the same, like for instance in my practice, we have it the first Tuesday of every month, so that everyone knows that there's a staff meeting that day. Be prepared and be there. And again, similar to the morning huddles, these are not times to be gossiping and griping about everything. Try to make them more productive. Try to focus on possibilities, maybe not just all the problems. And of course, if there's going to be problems, you're going to have to focus on those. But if you can try to, if you come to the meeting with a problem, try to have a solution. Don't just be the one that shows up with all the problems but don't want to take any responsibility for helping solve those problems. The ninth thing on the list is KPIs. Make sure that you're following those. You doctors, make sure that you're paying attention to those reports, not just the staff members or the office manager. You want to make sure that you know what's going on as well, especially with adjustment reports, daily deposits. Make sure that everything's matching up, because we don't want anybody getting taken advantage of. So make sure you're following up with those. Most all dental software programs have great reports for that. Weave, Dental Intel, all of those guys have great KPI reporting as well. And that you can, even if your doctor's not in the office, they can look on the apps or on the online and look at all the KPIs for the day or the month or year, whatever it may be. And the last one, which I think is the most important one, is team recognition. And doctors, office managers, you're going to want to make sure that you're encouraging your team, make sure that they know that they're doing a great job. And a little things can go a long way. And I was just looking at a report, and it said that 71% of employees are currently looking for new positions. And I just think with the cost of turnover and training and hiring, if you have a good team member in your practice and they're productive and they show up and they're dependable, then try to encourage them and make them want to stay and not be one of those 71% of people, because I hate that there's so many great people out there and they're just not happy in their jobs, and it's just not right. So if you can, encourage them, make sure they feel like they're doing a great job, make sure they feel thanked, and like I said, the little things can go a long way. But if you need any help, give me a call, email me, hickorydentalgeek@yahoo.com. Of course, follow me on YouTube, Instagram, Facebook. I'm always here if you have any questions, and I hope everybody has a great Saturday, and I'll talk to you soon. Bye.